Hello, my name is Nick. I'm a third-year optometry student, and I'm from Allentown, Pennsylvania, and I'm here to show you guys a tour of the Eye Institute today.
Hi, I'm Kara. I am also a third year here at PCO. I am from the great state of Ohio, and we'll just walk you through a day in the life of an optometry student.
All right, so let's get started.
Initially, we're going to get out all of our equipment. It's a lot. As you can see, we have our luggage and our bags for our equipment all set up. Usually we put it on the desk, that way it's handy for when we need it. So we come in and set up, and then the next thing we do would be to check our patient list for the day. So we'll go into the system, see who is scheduled for what appointments, and then see which doctors we're under. And once we'll review the patient chart, we'll go grab the patient and bring them back. And we have our chart. Since it's not a full 20-foot room, we do the mirrored. And then we will do our refraction, all of our entrance testing, make sure the patient's system is intact, and then it gets to the fun stuff where we're looking at their ocular health. So this is our slit lamp. Honestly, one of my favorite parts of clinic. Basically, you can go in and look at the patient, check out the back of their eye, assess pressures. Basically, it's a one-hit wonder. And then we also have our handy dandy 4-opter here. This is what helps us judge the patient's prescription and finalizing that. And that's pretty much it. After we have initially looked at our patient, assessed their vision and their ocular health, we want to check in with our residing doctor, and that is Dr. Karbach. So what we do is we present the case or the patient to the doctor, say if we have any concerns, if anything is remarkable on their entrance examination, and just tell them the bullet point facts of what we would want to focus on. And it's usually a very direct and straightforward process as which we're presenting. So I would say, hey, Dr. Karbach, I have a 15-year-old female. She's in here for her annual eye exam. She broke her glasses recently and is in need of an updated RX. There are no systemic or ocular health concerns. I did look in the back of the eye. Everything looks intact and healthy.
All right, great. Does she have any other complaints?
No.
Oh, great.
For COVID, our cleaning procedures have changed a little bit. At the beginning of the day, we usually come in and there is a green tag on their door, and that's just to signify that maintenance has come in and done a deep clean overnight. Usually we'll clean in between patients if we're here for a double shift, but for the most part, they'll come in, do a deep clean at the end of the night, or if they have time between the shifts, you might see the green tag on your door. As far as our protection, we are given double masks. It's a requirement now. We have goggles, and then also in addition, we have access to our gloves, and we have the face shields over here on the slit lamp for whenever we are close to patients. As far as cleaning procedures on our end, we want to be making sure we're wiping down the room between every single patient. So we are given a bottle of a diluted bleach solution and heavy duty paper towels. And basically what you want to do is we take out the paper towels, spray it down with the bleach, and then proceed to clean all of the touch spots in the room. So we might start with the exam chair and making sure it's all cleaned down. We'll probably clean the lights, the towers, basically anything that you or the patient have touched, just in case another patient needs to come into the room or faculty need to come in. We'll also wipe down the keyboards. We have hand sanitizer readily available, and then we also have a sink in every room.
We have 3 main primary care suites, all 3 of which you have your main entrances down the hallway to. And so we're going to keep walking down the way. That's Dr. Gerwood down there. You can say hi. There you go. We like to have fun here. So let's start going down this way. All of the primary care suites have 9 exam rooms. So typically on a day, you're going to have 9 students with you. And each one of you will see at least 1 patient a day, if not more, depending on how busy the schedule is. So let's head down this way. We'll head over to the actual team room and we'll talk about it when we get there.
And the great thing is even if you don't get a patient on the day that you're scheduled in clinic, with our new Blackboard Collaborate program, we can actually turn on video in each of the rooms so you can observe patient encounters on that day as well.
Right, so this is one of the team rooms. Each individual suite has their own team rooms. We can head inside and get a better look. And so each team room, like I said, has 3 little cubbies that each one of your preceptors will be in. When you come out after you're done seeing your patient, you'll report to your preceptor. And right here is where you kind of go over the case a little bit. You learn, different things about the case, whether it's a medical exam, whether they're here for a vision exam, things like that. Typically, in normal circumstances, we would have a round table where all of the students in the suite gather around, and they'll put a case up on the computer, and we'll go over the case. Sometimes it's a case from that day. Sometimes it's a case from previously. Unfortunately, due to COVID-19, we haven't been able to do in-person roundtables. So what we've been able to do, though, is on Blackboard Collaborate, which we have just mentioned with all of the webcams, we're able to do that virtually, and we can do virtual cases. So you're still getting a lot of case studies, and you're still getting a lot of exposure to different medical diseases, ocular, vision, things like that. All right, so I think that's pretty much it for the primary care. I guess we can move on if we'd like. Before we came into primary care suite 1, we did pass the emergency clinic, which is the first 2 exam rooms when you walk down the hallway that we just did. It's typically triaged by one of the preceptors here at the Eye Institute. Typically you'll see anything from red eyes to people that have loss of visions. You'll get walk-ins, patients that just walk in saying like, I have this symptom going on, can I be seen? They'll be triaged in a separate room where the doctor will come in. They'll do basic question evaluation of them, and if it's deemed necessary to be seen in emergency, they'll be seen. But I would say emergency is definitely where you get to see some interesting cases.
And it's awesome too because a lot of patients might not know it's an option. So even if we're seeing patients on a day-to-day or like annual basis and they're having a problem, we can mention to them like, hey, we have this really awesome emergency service to where if you're concerned and need to be seen right away, you can just walk in.
This is the specialty testing suite. I believe it's suite 4, the technical name for it. So this is where all of your diagnostic imaging and testing is going to be done. So if somebody needs to get an OCT done, somebody needs to get fundus photos done, or visual field, this hallway right here is where all that will get done. Currently, the diagnostic imaging area has 2 OCTs. They're both Zeiss Cirrus OCTs. And the cool thing about that is they have software on them that does OCT angiography, which actually looks at blood flow, something that some other OCTs don't do. But that's a cool software update. We also have new visual fields, Humphreys visual fields, that have actually a liquid trial lens in them, making it different from a normal Humphreys visual field where you have to pick and choose different lenses. You basically, with these new visual fields, you just put in their prescription and the liquid trial lens will make the prescription for them. And it saves a lot of time, and it's really, really cool technology. We also have 2 fundus photos. Both are excellent in quality and imaging. You can get images of the back of the eye in multiple positions of gaze to really get a good view of the person's eye. Do you have anything else you'd like to say to that?
Yeah, I believe we also have a Goldman bulb.
Oh, right, absolutely.
Which is really super awesome because they are not really that common anymore, but since we have the neuro service here and we do take a lot of neuro cases, that's an awesome tool to have at our disposal.
All right, so the next part that we're going to show you is our specialty clinic, which is pretty much this hallway right here. It's technically called Suite 5. This is where a lot of, like I said, specialty clinics will see patients. So that's like glaucoma, low vision, neuro, and contact lens are the major ones, as well as we have a retina doctor that comes in once a week to see some retina patients. They usually fill these rooms right here, so they're not all here at the same time. Some of them will be in during some points during the week, but you at some point will rotate through one of those sites or through one of those services. But right now, us as third years, since we're trying to limit the amount of people that are in the room and not observing like the patients, what we've been doing is, just like we've talked about before, we've been able to use Blackboard Collaborate, and they've been able to, with consent of the patient, film an actual exam in these specialty services. So we're still getting exposure to those different cases, and we're able to see all kinds of different issues with different services and ocular disease. So we're definitely getting the full extent here in the terms of COVID-19. So
yeah, and just like we talked earlier, you're going to form an assessment and plan for those exposures as well. So even if it might not be your patient or you just watch the case online, you're gonna think about the case, think about what you would do, and submit it to your assigned preceptor for that coursework, and then they're gonna give you feedback as well for those encounters.
One thing I did also want to mention about our contact lens service here, it's not what you might think in terms of contact lenses. They're not your typical soft contact lenses that some of you may be wearing. If you're sent to the contact lens service, chances are you're probably going to be getting more specialized contact lenses for ocular diseases such as keratoconus. So it's not just, oh, we're making, normal contact lenses. It's the real deal, and we have a great contact lens service that's very, very helpful.
And we also talked about the visual fields and the OCT. As far as the contact lens service, we have our topographers. This is basically going to give you a map of the front surface of the eye. So with those keratoconus patients, we can fit the lens on there and give them the best line of vision that we can. So we do anything from RGPs to sclerals, and we even have students doing ortho-Ks right now.
Yeah.
So that's really cool exposure to have.
Yeah, the topographer we have is actually really cool because you can take the measurements that they get on the eye, and the machine can actually predict what kind of contact lens it specifically needs and what kind of staining that will happen in terms of touching of the lens on the eye. So it's really cool. It's like, I think it's not even a year old, so it's brand new.
Yeah.
Great technology. Yeah.
Mm-hmm. This is some of our low vision.
Oh yeah.
For our low vision and rehabilitation patients, this will let them check out different magnifications and different devices if they have severely reduced vision or a field of vision.
Yeah.
Now we're in the Ped Suite.
Yeah, absolutely. Talking about pediatrics. So interestingly enough, though, you might not even see a pediatric patient in pediatrics sometimes. Sometimes you'll see patients that had an injury with traumatic brain injury or something along those lines, where they may need specialized vision therapy because their eyes may not be converging or diverging correctly, or they might have trouble focusing at close because of the trauma that they experience. So just because you're in pediatrics doesn't mean you're just going to be seeing kids. A large majority of the patients obviously are kids, but you will see some adults here as well.
And that can range from binocular vision disorders to accommodative disorders, and that's really just ensuring that the patient can use their vision efficiently and work to align their eyes.
Yeah, absolutely. One of the interesting things that they used to have here was, we used to all wear white coats, but we've since then transitioned over to scrubs, as you can see now. In pediatrics, though we wouldn't wear our white coats just because, the white coat can sometimes be a little bit intimidating to some of our younger patients. But now we're all kind of wearing these
we're just
hunky-dory scrubs and
chill.
Everything's
they love
great.
It, honestly. We love it too.
Yeah. So if you look down that hallway right there, you'll actually see the teen room. It's very similar to the teen room that we saw in primary care. It's got the 3 cubbies. It's got the table, the round table in the middle. This is where you would meet up for if you were scheduled in pediatrics. Part of the pediatrics service area is this room right here, which is our vision therapy room for some of our pediatric patients that we talked about and some of the adults with traumatic brain injury. Here they can go through a multitude of electronic and non-electronic therapies to help with their convergence, divergence, their focusing. It's really cool, sometimes like a lot of them, they got this controller here, sometimes they're just basically playing video games on like a computer screen, or they might have something a little bit more static, which these are called Brock strings. That's another type of therapy that they might use to help with convergence or divergence issues.
So another part of the vision therapy room is you can work on pursuits and saccades with your patient. So what that entails is our letter charts, as you see throughout the room, and basically the patients will work on the control of their eye movements by going from one end to the next, and then once they get all the way through, they'll move into the inner columns, and they'll keep going down each of the columns until they're all the way through.
So this area right here is the optical shop that's attached to the Eye Institute. There are some instances where you will be sent here for one of your shifts. And here you would do a lot of glasses dispensing. A patient may come in, they need an adjustment on their glasses, things like that, or you could be helping them select a frame. In your first year, you'll actually do a optical rotation, typically somewhere of your choosing. And you rotate through that optical and you learn a lot of the skills on how to make adjustments, on how to select the specific designs for patients, whether it be for bifocals, progressive lenses, or just single distance vision lenses. You won't rotate here as much as some of the other services, but it's definitely a good place to hone in on some of your technical skills in terms of optical shop.
And one of the key things is that even if you prescribe a patient glasses, you can make recommendations straight from your exam room. So anything from like anti-glare coating to if they're having trouble with light sensitivity, you could recommend transitions. And those courses in the optical in our work here really helps us solidify the foundation of, okay, what can I do to help my patient function in their glasses that I'm giving them? So we are in the contact lens room. Basically, this is all of our trial lenses for our soft contact lenses. So depending on brand, the prescription, if they are in multifocal contacts, you can come in here and check to see if they have options for your patients, fit your patients, see if they work, and then send them with a trial before bringing them back and finalizing the contact lens.
Yeah, absolutely. We have a wide variety of different contact lenses, like you said, dailies, multifocals, biweeklies, monthlies. We have a lot of different contact lenses. Even here, they actually have one of the new AccuView Oasis with transitions. That's something that just came out within the last year and a half. So we have those now in case patients want to trial them and try them out. So you definitely get a wide variety of contact lens exposure while you're here.
And one of the good things is that they do have a contact lens program for students here at PCO, and basically that's them partnering with different name brands of contacts, and you can actually get fit in the lenses and get like free trials from the company. So you'll fill out a form, your preceptor will sign it, make sure they finalize you in that prescription, and you can actually try those contact lenses and give your patient a personal experience of how you felt those lenses fit on your eye as far as comfort, if they ever dry out and everything like that. So it's really handy to have those in-pocket experiences.